Hello everybody, welcome to my channel. In this video I want to talk about 5 important concepts you need to be aware of for the MCAT. So first one, a public health team is studying why certain neighborhoods have higher childhood vaccination rates despite having similar average household incomes and educational levels. Neighborhood X residents attend frequent community events, participate in neighborhood watch programs, and share childcare responsibilities. Neighborhood Y parents commonly hold advanced degrees, speak multiple languages, and expose their children to museums and extracurricular activities, but have limited interaction with other families in the area. Which of the following best describes the dominant type of capital influencing vaccination rates in neighborhood X and neighborhood Y respectively? There are two types of capital. We have cultural capital and we have social capital. Cultural capital is about what do you know. So your skills, your abilities that are valued by the society. It's not related to your relationships with others. It's about you, what you know, and what can you do. Social capital, on the other hand, is not about your skills, is about your connection to others within the society. So cultural capital is about what do you know, and social capital is about who do you know. For neighborhood X, each member knows many other members and they help each other as they can. So that's a sign of social capital, right? But for the next neighborhood, they're not necessarily as connected to each other, but each member is highly skilled and highly knowledgeable. So we can go for answer choice B. Next, a researcher is studying cognitive abilities in children aged 2 to 12. These tasks are administered. Task A. A child watches a researcher hides a toy under one of two cups. The researcher then moves the toy to a new cup while the child's view is blocked. The child is then asked to find the toy. Task B. A child is shown two identical clay balls. The researcher flattens one into a pancake shape and asks the child which has more clay. Task C. A child is asked to categorize animals and plants based on shared properties rather than superficial appearance. If the child successfully completes task C but fails task B, which of the following is most likely true about the child's Piaget stage and approximate age? In order to answer this question, we need to know about the Piaget steps of development. So here is a Jack Westin visual which is very helpful. So the first stage is semi-sensory motor stage, which is characterized by gathering information from your environment through sensory input, and also is characterized by object permanence. So object permanence is when you show a kid something and then you just hide it and they think the object is gone completely. And stage 2, pre-operational period, development of symbolic thought marked by reversibility, centration, and egocentrism. And for this stage, you need to know about symbolic thought, and also you need to know about egocentrism. Stage 3, concrete operational period, is mental operations applied to concrete events. So now you're moving away from symbolic thoughts to more concrete thoughts. And for stage 4, you are thinking about more abstract ideas like ethics, justice, things like that. And if you go back to our question, for task A, we are basically checking for object permanence. We are trying to see whether the child has passed through sensory motor stage or not. And as the question indicates, the child indeed passes the test. So the child is not in the sensory motor stage. For task B, we are basically checking whether the child has an ability to tell different amounts, right? So the child is able to tell whether the two clays are actually the same, although there are different shapes. And the child doesn't pass this task, but passes the task C, which involves categorizing animals and plants based on shared properties rather than superficial appearance. If we look at our answer choices, we have concrete operational stage, pre-operational stage, formal operational stage, pre-operational stage. And the correct answer here is the pre-operational stage. So you might ask, why the pre-operational stage? Because first of all, we know that the child is not in the sensory motor stage. but didn't pass task B, which asked the child to basically tell whether the two balls are actually the same size. And that refers to a concept called conservation of quantity. So conservation of quantity is mastered in concrete operational stage because kids start to think in concrete terms, and that's when they develop the ability to tell whether two objects that have the same size but different shapes actually have the same size. The chart doesn't pass that stage, so we cannot say concrete operational and we cannot say sensory motor. So the answer is pre-operational stage, 4 years old. And so for the next question, a trainer is teaching a dog to retrieve a ball in a new complex behavior sequence. Step 1, touch the ball with its nose. Step 2, pick up the ball. Step 3, carry the ball to the trainer. The trainer uses shaping, rewarding the dog only as it progresses to the next step. After several sessions, the dog consistently completes the full sequence. The trainer then stops providing rewards for any part of the behavior sequence. Which of the following is most likely to occur first, and which behavioral principle explains it? So basically, the dog was rewarded for each stage, but the dog is not being rewarded anymore. In this case, something called extinction happens. But before the extinction happens, something else happens, and that's called extinction burst. So before completely giving up, the dog tries to do the behavior as many times as possible in order to get the prize. So temporary increase in partial behaviors, but then there is extinction burst. Correct answer, answer B. 9. A vision researcher conducts a study with participants in a completely dark room. They test detection of a dim light under 3 conditions. Condition A, the light is turned on for 0.1 seconds at varying intensities. Participants press a button if they see it. Condition B, a light of fixed intensity is on continuously, and the researcher slightly increases and decreases the brightness in small increments. Participants report if they notice a change. Condition C, the same as condition B, but the light is brighter overall. Findings. In condition A, participants detect a light only if the intensity exceeds a minimum percentage perceptible level. In condition B, participants reliably detect a small difference in brightness between two stimuli. In condition C, participants require a larger change in brightness to notice a difference compared to condition B. Question: which of the following correctly identifies the threshold concepts being tested in each condition and the principle explaining why the change is larger in condition C? Okay, so we need to define some terms: difference threshold and absolute threshold. So difference threshold is when you already have the stimuli and you just change the amount of stimuli so that you can check whether the participants can tell whether the intensity of the signal was increased or decreased. That's difference threshold. Absolute threshold, on the other hand, checks whether the participants can detect the stimuli at all. So in this case, for both conditions, we do have the signal present. So participants can already tell the signal is there. And the researchers are looking for the difference. So we can say absolute threshold, B and C, these are not correct. But A and D have the potential to be correct. So for A is difference threshold and B is absolute threshold. And we already talked about the fact that both of them should be absolute threshold, because in both scenarios they are checking whether the participants can tell the difference in intensity. So A is wrong, B is wrong, C is wrong, but D is correct, because in both cases they are checking for a change, not a presence. And these are explained by the Weber's law. The second part of the question says, in condition C, where light was brighter, participants needed more change to tell whether the intensity has changed. And that's because under the Weber's law, if the baseline intensity is larger, the just noticeable difference is also larger, and vice versa. Last question. A longitudinal study follows three children from different cultural backgrounds. Researchers observed the following behaviors. Child A, age 2, frequently explores the environment but consistently checks with the caregiver for reassurance. Child B experiments with different friend groups, hobbies, and fashion styles, frequently asking peers and family for feedback on choices. Child C reflects on life accomplishments, expressing satisfaction with the past decisions, but occasionally regrets missed opportunities. Which of the following correctly identifies the primary Erikson stage for each child? So, in order to answer this question, we need to know about the Erikson stages. And these are the stages. We have the trust versus mistrust, autonomy versus shame, initiative versus guilt, and so on and so forth. The first child frequently explores the environment but consistently checks in with the caregiver for reassurance. So that's about trust versus mistrust, right? So here, the first stage, infant from 18 months. The crisis they're facing is trust versus mistrust. And if we come back here, the child is 2 years old, which falls within the age range. So we can say for the first one is trust versus mistrust. And for child B, 16 years old, experiments with different friends groups, hobbies, and fashion styles, frequently asking peers and family for feedback on choices. That's identity versus role confusion, because they're trying to find their identity, but they're also confused. That's why they're asking these questions. That's B. And C, integrity versus despair. This is one of the final crises we face, and this happens late in life. So I would say D is the correct answer. Thank you for watching. Don't forget to like and subscribe so you can see more of my videos.